I just love that song. You know, I have a bit of a confession to make to everyone out there. Back in 1998, I actually, you know, Ponting Sekolah wanted to actually see them down in KL.
Wow. No wonder I didn't know they came down, because in 1998, I was about 6.
No, don't disclose that. You don't need to disclose that. It's fine. I mean, it was when you were younger.
When I was younger, right?
Exactly.
But things I do need to disclose is that, so I found this article, right? Dated last year, that do y'all know that Malaysia's 2020 fertility rate was the lowest in 4 decades? Now, the total fertility rate of women of reproductive age in Malaysia has actually declined to 1.7 babies in 2020 as compared to 1.8 in 2019.
Wow.
So does this mean women are just not fertile at this moment? And I want to find out the reasons why, because you know, as a woman myself, as a growing woman, eventually I will want to have a baby. And of course, I'm inspired by you as well. You and your wife have tried for about a couple of years, right?
5 to be exact. Yeah, exactly. I mean, like, it's not as simple as one may think, because like, you may hear most of the time your friends are having a baby and it's so simple, but sometimes there are couples out there who have been trying and to no avail. They are not able to actually, you know, get a child of their own. And some of them, they would want to resort to an alternative method, and hence why today on this show, we have an expert to talk to us more about the fertility issue. We have in the studio Dr. T. Swee Peng, founder and fertility consultant, Metro IVF, as well as the president of the Malaysian Society for Reproductive Technology. Dr. T, welcome to the show.
Good morning.
Morning.
Thank you.
Yeah, welcome, Doc. So, you know, that news, I mean, it's something that I think women still talk about, but not talked about enough, right? So can you actually clarify the article that, you know, Malaysia has hit, or Malaysian women has hit the lowest in, you know, fertility rate for 2020? Can you explain it to us in layman terms? What does that mean?
Oh, it means that the women today, more of them are having what called babies that at a later age. As based on that figure, it also says that the age of the woman having their first baby has increased from 27 to 28 years of age.
Oh, okay.
So these women are now having their first baby at a later age. There are a few reasons for that. Because today's women are different from, let's say, many years ago. They are housewives. So today, women are career women. Even I think quite a lot of them are having master degree, PhD. So obviously, they will delay their age when they have their first baby. And they are very career oriented. With the urbanization, I think they are having a different lifestyle. And so it is natural for them to differ. And by the time they decided that they want to have the first baby, their age would have risen. And then they start to have another problem called subfertility, more difficult to get pregnant.
Subfertility.
Yes.
All right, okay. Now, because as you mentioned directly there, I mean, it's something that you can actually look into in regards of how it was, you know, 20, 30 years ago, during our mother's time, during our grandmother's time. You may be as young as 20 years old when you had your first child, but now the fact that the world has become a bit more competitive, women are concentrating more on their careers as well. We can't fault them, obviously. Everybody would want to have success in that sense, but maybe, Doctor, you can just like share with our audience the pros and cons then actually. Should you delay your pregnancy, maybe right up until 40 years old? What would be the pros and cons of having a child then?
Obviously, if you are of high age group, you'll be more prepared physically, mentally, or financially. So in other words, women, if they have the child, let's say at 35, of course, they can better cope with the newborn when they carry the baby. But if you were to delay to have the baby at about 40 or so, then you have one of the biggest problems, that is subfertility, difficulty to getting pregnant. Let me illustrate. If you are 20 years of age, if you try the first month to have a baby, you get 30%. Whereas if you at 40, it dropped to 4%. Imagine the drastic change of your chance of getting pregnant. And if you are at, let's say, 25 years old, and you try for 1 year, 90% of you will get pregnant, need not to see any doctor. At this age of 40, you will try for 1 year, only 10% of you get pregnant. So 90% of you, on the reverse side, you have to go and see a doctor. And at the end of the day, if you are 40, you try hard, only 20% of you will have to get your baby by the natural means.
All right. So, 20% is quite a staggering number, right? It's not a big number, it's quite a small number. So for our ladies out there who are in their late 30s to 40s who are thinking about taking IVF, we have a couple of celebrities, I think. Datuk Sri Siti is
yes, she's the popular one.
That have done IVF, who've tried and couldn't get a baby naturally, and she opted for IVF. So to our audiences who have never heard of the term IVF, can you explain to our audience what does IVF mean, and what are the process of doing IVF?
Oh, yes. IVF, if you look at the word itself, in vitro means outside on a test tube. Fertilization means the egg and the sperm are fertilized outside. So what happens is basically the woman will be receiving injection for a total about 9 days. And then we try to get as many eggs as possible. Normally, one cycle, a woman only got one mature egg. But with IVF, we try to achieve 10 to 20 eggs. All these are collected outside, and we fertilize what we call the eggs with the husband's sperm. And the sperm is also processed so that the best sperm from the husband will fertilize. Then we grow this embryo, which is 1 day, 2 days, 3 days, up to 5 days. After that, we're transferred straight into the uterus. And then we usually transfer 1 or 2. And then within 14 days later, we can confirm she's pregnant or not. So in other words, we assist all the way to make the embryo attach to the uterus.
All right, very, very interesting, because again, these are the kind of things that I personally, my wife and I, we actually studied up on IVF as well, because again, both my wife and I, we've come to that age that we thought that it's going to be difficult for us to actually get pregnant. But before you explain further about IVF and the pros and cons, obviously, of having IVF, what would make it, why would a couple want to go through IVF? Is it really something that the mother, or should I say the mother-to-be, cannot produce enough eggs, cannot produce healthy eggs, or maybe the placenta is not really, strong enough to actually handle a proper, or should I say the conventional way of having, a baby?
Oh, yes. I think to make it very simple, there are many factors on the journey to get pregnant. And 5 of the areas can be the source of the reason for IVF. Number 1 is the hormone from the brain of the woman go and stimulate the eggs. If that is lacking, no eggs is produced. Number 2, the eggs there is not enough or not strong enough. The third one is the uterus got some problem. 4th is the tube is blocked. Of course, when it's blocked, there's no way the egg can meet the sperm and no baby can form. All the sperm that's down there that's coming out is too weak. So any of these 5 factors can be a reason. It is for that reason, if you cannot get pregnant for more than a year, go and see the doctor. Doctor can identify. You see a gynecologist. She will find the reason, and some of the reason they can actually solve for you without seeing the fertility doctor. Because it's very costly to do IVF.
Speaking of costly, do you mind sharing an estimate cost? How much does it? An estimate range. How much does it actually take or to pay for IVF? I assume it's a very costly procedure, right? And I've heard in America it costs about, I think, easily 5 figures, depending on how often you do it and how many eggs you extract and whatnot. But here in Malaysia, roughly what's the cost?
Basically, you know of only 2 costs. One is the cost to do an IVF and transfer inside. That will cost approximately 15,000 to 20,000.
Wow.
Now, there's also a second process where if you have many eggs, you got frozen, then they can use the egg to transfer inside. That will cost you about 5,000 to 6,000.
Wow.
All right. So it's definitely a heavy investment when you're talking about an IVF. And I believe that most couples, when they look at IVF, is basically they're at a point where there's nothing else that they can actually do apart from investing into IVF. Now, the one question that I do want to ask you is that, what are the success rate of having an IVF? Is it 100% that you will get pregnant should you actually go through the IVF procedure, doctor?
Oh, the success rate of IVF a lot depends on the age of the woman. So if a younger age group, you can even have a success rate of 60 to 70%.
Wow.
Whereas in a higher age group like 40 and plus, you can get about 20 to 40%.
Of success?
Yes, success rate per cycle.
Per cycle?
Right.
Per cycle.
Right.
So in other words, no center can guarantee you 100%. Because certain factors are always present that will negate the success rate.
Yeah, which also includes the quality of semen of the men, right?
Of course, yes.
Right. We don't want to be too, leaning too much on the woman itself, because the other day, it takes two to make a baby.
Yeah,
exactly.
That's right.
So, coming back to our topic, so we're speaking about getting IVF at a later age. What are some of the factors or some of the considerations a woman needs to understand or know first before proceeding with IVF? Does she need to be healthy? Does she need to live a healthy lifestyle? Does she need to first get her eggs checked? What are the procedures, and what should I know before I take IVF?
Okay, we are looking at a woman who is 40.
Yeah, looking at an older woman.
Yeah, first thing, she has to check, make sure she don't have hypertension, diabetes, or any illness for her physical health.
Right.
Because she is going to carry the baby for the next 9 months, and she has to be ready. Then the next thing is the doctor will have to assess whether the uterus is okay or not. Because at this age, she has a high risk of having endometriosis, fibroid. Of course, these are the common illnesses. She has to check and get rid of.
Right.
And we have to assess whether the egg reserve is good or not. If the egg is no good, then she will require different approach. Good, then it's a different approach. And to check the husband's sperm. As you said, we need to call the husband in as well.
Wow.
So again, a lot of factors that actually come into it. You need to be, free from any kind of diseases. That's what you have mentioned, doctor. But also, there has been some rumors out there. Again, from what I've actually learned itself, they say that IVF, you only do it one time, and then you can keep on trying. It's not like that, isn't it? One procedure of IVF is the one chance that you can get yourself pregnant. Is that true?
I believe you are wanting to know how many times a woman can undergo IVF before she gives up.
Correct, yes, that's what I mean. Yeah.
Okay, studies have shown that every cycle she adds in some success rate. And there's a very big study in America. They found that you can try even up to 9 times. And each time you still add some success rate. And they start over 200,000 couples. So that result shows that women should not give up trying, even if they fail.
Okay.
Yeah, it is definitely in Malaysia is different because the cost of IVF is so expensive, and the disposable income in Malaysia is not that high to cover up to 9 times. So if you have a lot of eggs, you can freeze it. Then, as I said, the cost of frozen embryo transfer is only 1/3 of that of IVF.
Wow.
So each time when they do IVF, try to keep as many any of these embryos as possible, so they can transfer many times.
Right. For women out there, so I think having watched a lot of videos, especially about fertility, a lot of doctors out there actually advise that. I'm married now and I'm leaning towards my 30s already. And if I choose to have a baby at a later age, I should start freezing my embryos now, because that's when my embryos are the strongest. I should freeze my eggs now, because now that's when it's the healthiest or it's the strongest. Now, is that true?
Yes, it's very true. Those carrier women, well, good. You're now in your 30s,
Leaning 30s, not yet. Leaning 30s.
She's very touchy when it comes to age, yes.
Okay.
I'm looking forward to hit 30s, but not just as yet.
Yeah, so you asked a very good question for the public as well as for you. Okay, they found that women who are going to delay their pregnancy or want to have children later, or because they're not married, you're married, very good. Yeah. So this woman, it's better for you to freeze your egg. Because when you freeze your egg is marked now, let's say 28 years old. Okay, now when the age of the woman goes, not only she have difficulty in getting pregnant because the egg number drop, but the quality of the egg also drop. And when you bear a baby, this baby are more likely to have miscarriage as well as abnormalities. So if you were to freeze your egg now, assuming later 40 years of time, or 10 years later, you come and say you want to have a baby. You take out this egg, and this egg is actually marked 28. years old.
As the day that you extracted it?
Yeah, extract it.
Okay.
In other words, you put it very simply, a woman 40 years old, you got special medicine, and now she looks at the age of 28. It's marvelous. You actually can go back in time as far as getting pregnant is concerned.
Talk about back to the future right there, right? Okay.
We actually have on the screen, so getting pregnant advanced maternal age. So these are the challenges, right? And how to handle the challenges. So part of the challenges is low egg supply, eggs with defects, takes longer to conceive, and higher risk of miscarriage. Now these are for women who are leaning
out of age, I guess.
Does this matter actually? Does it matter that what age they are at? Because some younger women as well, they also find it difficult to, have good eggs. Is that an age factor or not?
Is it environmental?
Oh, it's true. What happened is we have put it to understand the basis of this statement is that when you are at puberty, the lady got puberty at 30 years of age, she has about 500,000 eggs. And this 500,000 egg got different qualities. So every month, the hormone from the brain will stimulate the eggs and raise up about 30 eggs. And they always wake up the best 30 eggs.
Right.
Yeah, so if you waste it when you are from 3, you are doing SPM, all these are actually the young, good eggs.
Yeah.
So when you reach about 37, then the egg number will be less, but the remaining eggs that's down there are of the lower quality.
Okay,
so it's because of that, if you have pregnancy at this later age, the baby is of a different subset compared with the
So basically, the better eggs have been, let go, and you're stuck with the, lower quality eggs, if I may say so.
That's right.
Having said that, though, would there be risk as well? Because I've also read that, at a higher age, women of a higher age, older age, they would have a higher risk of having babies with certain kind of syndromes like Down syndrome or whatnot. Could that also be a problem that someone can foresee?
Yeah, you say the word Down syndrome.
Yeah.
Down syndrome is age-related to the woman, not to the man.
Okay.
So if a woman, example, at the age of 25, the risk is 1 out of 1,005 babies. You go to the age of 35, it's 1 out of 300.
Wow.
You go at the age of 40, the egg is of a different category. Your risk of Down syndrome is 1%, 1 out of 100.
1 out of 100. Wow, that's a very that's a high chance there.
That's a very, even though it's 1%, it's quite a scary number.
Oh yeah,
as well. In that case, is there anything our audiences can do to prevent this, or is there a way to prevent, the woman besides getting pregnant earlier, to prevent Down syndrome, essentially?
Indirectly, yes. Directly, no. In other words, if you are going to have a Down syndrome, it is a Down syndrome. You cannot make the egg better to get no Down syndrome. But in the processes of conception, particularly if you are doing IVF at the age of 40, then we can actually take the embryo, take out a few cells, and go for analysis. If we check the cells, say, hey, these cells shows Down syndrome, we throw away this embryo. Then the second embryo we take and say, hey, there's no Down syndrome. We will use it for transfer.
Now, speaking of which, completely off from Down syndrome, I just remember, because you were talking about picking and choosing, bad eggs and the good quality eggs. Actually, Chrissy Teigen, John Legend's wife, also did IVF, and she was famously quoted for wanting to have a baby girl specifically during her first pregnancy. So is that also possible for you to determine the gender of your baby through IVF?
Oh, yes. When they identify in the biopsy, they identify all the 23 chromosomes, from number 1 to 23. The 23 will tell you whether it's a boy
X or Y. So you can actually pre-plan if you're doing IVF.
Provided, this is a very sensitive issue.
Understand. Okay, we've actually come to the end of our show, but before we leave, Doctor, maybe perhaps just information for our viewers out there. Should they want to know more about IVF from Metro IVF, where can they get the information from, Doctor?
Oh, they can go to the website and Google for Metro IVF.
All right.
And there we have contact number. You can contact us for any advice or whatever things you need to know.
Right. right.
Okay.
Well, thank you so
Alright,
much again,
lovely.
Doctor. We've had such an insightful morning.
Yep.
Definitely made me less scarier to get pregnant in the future. But knowing that I have plenty of options, again, makes it a lot scarier. So
Yeah.
speaking of somebody who's less scary,